Okay, so water is going to be a vital component of the human body. It's going to make up of about 60% of total body weight, total body water in an average adult. Now, this water is going to be distributed across different compartments. Each is going to be playing a critical role in physiological function. All right, now the fluid compartments that we're talking about here are going to be intracellular fluid, which is going to make up about 2/3 of total body water. Now, this is going to be found inside cells. So when you see intracellular, you can remember it's inside cells. It's going to form that internal environment where those cellular processes are going to occur. We also have extracellular fluid, and that's going to account for about 1/3 of total body water, and extracellular, extra meaning outside cells. All right, and this is going to be found outside that cellular environment. All right, now we can divide this extracellular fluid into two main components. We have interstitial fluid, which is going to surround tissues and cells. When you see the word interstitial, inter meaning between, stitial, tissues. So between the tissues and the cells, interstitial fluid. All right, again, that's going to make up about 75% of that total of extracellular fluid. Okay, now plasma is going to be the fluid part of the blood, and this is going to make up about 25% of this extracellular fluid. All right, so the key point here is that we're going to need to have balance between all of these compartments to maintain homeostasis. All right, and this is going to be important in supporting cellular functions. Now, there's several factors that influence this total body water. First being body composition. All right, now fat's going to contain less water than lean tissue. When we talk about lean tissue, we're talking about muscle tissue. All right, and that's going to lead to some of the differences in total body water based on fat and muscle mass. So when we see an increase in body fat, all right, we're going to be seeing a decrease in total body water. When we see an increase in lean mass, we'll see an increase in total body water, or the opposite, decrease in lean mass, we're going to see a decrease in total body water. Right now, we can also look at this with different age variations. All right, in infants, we're going to see a higher percentage of body fat. All right, and so you would think that if we have an increased body fat percentage in infants, we're going to have that decrease in total body water. But that's not the case in infants. All right, and that's going to be primarily not due to the increase in body fat, but it's going to be due to the fact that a larger proportion of the extracellular fluid, they have a larger proportion of that extracellular fluid relative to what you would see in adults. Okay, the elderly individuals, you're going to see a decrease in total body water, and the reason for this is because they have reduced muscle mass and then that increased fat percentage. Okay, so understanding the volume and composition of body fluids is going to be important because we're going to use this in clinical practice. All right, we use this to diagnose and manage different hydration conditions or hydration status. All right, we evaluate dehydration or fluid overload, which conditions you're going to see like pulmonary edema or just peripheral edema, congestive heart failure. All right, and then we also can use it to provide the appropriate fluid therapy for those patients. We also address different things like electrolyte imbalances, and we have to tailor some treatments for the different electrolyte abnormalities, like hyponatremia, which would be like low sodium levels in the blood or plasma, or hyperkalemia, which would be high potassium. All right, those are just some examples, but these are going to be based on the distribution of electrolytes that we have in these specific fluid compartments, right? And the point here is that we can optimize patient care across the different populations because we'll have to recognize that total body water is going to be different, whether we're talking about infants or elderly, and that'll allow us to just customize some of those strategies that we can use for hydration and medical intervention. All right, so things that we would do, medical decisions that we would make relative to this would be things like IV fluid administration, or just doing some simple monitoring of the shifts in fluid during this period of critical illness for some patients.